The extended depth of focus lens, Edof lens, are advanced technology lenses that can be considered a middle ground between a monofocal and multifocal lens, a compromise. It will give greater range than a monofocal, but less than a multifocal. It will give you excellent distance and intermediate vision, but only 1/3 of patients may have good near vision with this lens. I would advise patients to be prepared to wear glasses for reading if they choose the Edof lens. This lens will have less to no halo profile as compared to the multifocal lens. It is usually well tolerated and easy to neuroadapt to, like a monofocal lens. The Edof lens works by elongating a single focal point and stretching it to achieve range of vision, as opposed to the multifocal lens that works by creating 3 distinct images on the retina. Technically, as we elongate the focal point, we should experience a slight decrease in contrast sensitivity, but in practice, this is not significant, and the Edof lens behaves a lot like the monofocal lens. There are 2 Edof lenses available to you: the Symphony OptiBlue lens by Johnson & Johnson, which is the newest lens, and the Vivity Clarion lens by Alcon. These 2 lenses are similar in performance. There are 2 configurations of Edof lenses that are useful to patients. The first is called mini monovision. If you recall, monovision is having a near eye and a distance eye, but they don't work together and may give patients issues with depth perception or a headache. Mini monovision is a milder form of monovision and works to offset the 2 eyes by only a half diopter to 1 diopter, as compared to 2 to 3 diopters in monovision. The dominant eye is set for distance, and the non-dominant eye is set slightly nearer, which gives a well-blended vision that allows the patient to enhance their binocular range even further, such that they can see well in the distance, judge depth, while also seeing well up close. It is a good idea to choose mini monovision if you plan to use Edof lenses in both eyes. The second option is to pair an Edof lens with a multifocal lens. In my view, this is the best use of the Edof lens. The Edof lens will help the patient's non-dominant eye see very clearly in the distance and intermediate ranges, as comparable to a monofocal lens, while the multifocal lens helps the patient's non-dominant eye see well in all distances, but especially for near. Stereo acuity is well preserved, and patients usually neuroadapt to this combination much easier than if both eyes were set with the multifocal lenses. In summary, the Edof is a compromise between the monofocal and multifocal lens, with less range than the multifocal lens, but for less side effects such as halos or decreased contrast sensitivity. For best outcomes, the Edof lens should be placed in the dominant eye for exceptional distance and intermediate vision, and it should be paired with the multifocal lens in the non-dominant eye to provide exceptional range, especially excellent near vision.